I will talk about the Strep B bacteria that are tested in in the vagina. It's the colonization of the group of B streptococcus that are colonized in the vagina, and it is tested with a vaginal swab test. It's a routine exam also here in Luxembourg that is done 34 to 36 weeks, or sometimes also later, but just before birth. It is not, well, it is this culture is not very reliable. It can change over the weeks, so if the test is done 34 weeks, the culture of the vagina can still change up to the birth. What are we looking at when we are having bacteria of Strep B bacteria in the vagina? So the risks are that the baby would get an infection of this bacteria. If the baby does get an infection, it can be life-threatening. But only 99% of the babies do not get any infection from Strep B from a mother that is positive. So it seems like the medical protocol that gives a mother antibiotics as soon as she is in labor, and from there on every 4 hours. Here in Luxembourg, that's the protocol. Every 4 hours seems exaggerated. And also that we can note that 40% of women have Strep B, test positive for Strep B. So 40% of the babies are born under antibiotics, which carries its own risks. The baby will be imprinted with antibiotics, so its microbiome that also is largely in charge of creating the newborn's immune system will be imprinted by an antibiotic, by synthetic medicine, and it can lead to resistances and antibiotic resistances, and I am sure to much larger impacts that have not been studied in details, because the influence of microbiome on the immune system is known, but there is still a lot of research to do in this field. The knowledge about positive, like when a woman has tested positive on Strep B, it already impacts her birth plans largely, because she needs to be in a place. Well, the protocol says that she has to be administered every 4 hours with antibiotics, so she will have an IV, she will be in the hospital most probably, can change her plans for home birth, and this changes the entire birthing milieu, the atmosphere of a fear that is lingering around this is very present, and adds to the nocebo effect, and can have an altering change on the birth experience. So if a woman tests strep positive, what should be avoided is the many vaginal exams, so the bacteria will not be pushed up into the vagina and close to the cervix, especially when the waters are ruptured, because the membranes are ruptured, because we have the baby inside. The amniotic fluid is protected, so the sac and the amniotic fluid, which is without bacteria or bacteriostatic, protects the baby, and we can assume that leaving the bag intact for as long as possible will prevent any subsequent infection of the baby, because if the waters break immediately before the birth, this water will wash out the vagina and probably clear the way for the baby's birth. So there will be less bacterial cultures present. And if there is a premature rupture of membranes, this is something that we can keep in mind to, not do any vaginal exams, of course, and to check after the birth on the baby. We can see symptoms in the baby that if he is irritated and changes the mood and does not nurse, or has some respiratory distress, or changes its color, these can be indications for an infection. So we keep it present in mind and follow the birthing pattern. And if after the birth the baby shows such signs, there should be an appropriate reaction.